evening, everyone. I am Dr. Srinivas, consultant neurosurgeon. Uh, this is a small information to people regarding stroke. Stroke can be either in a small way, it can be presenting either as a small stroke or in a big way. Usually it is common in middle age and in the old age people. For example, it is more common in smokers and alcoholics. So beware not to smoke, and stroke is very common in smokers, so try to quit smoking. Now that I am being in the state of West Bengal and taking the cold climate into consideration, most of the people I see they are smoking a lot. So please do not smoke and save yourself. Once if a stroke comes and if a hand doesn't work or a leg does not work, you become a burden for yourself as well as for your family members. So kindly request you, or it is my humble suggestion, that middle-aged people, youngsters and senior people avoid smoking. That is the most commonest cause for causing stroke. The second common cause is alcoholism. When you take alcohol, along with that you tend to eat a lot of food which is very oily food, which may be a factor in increasing your lipid profile. Your lipid values will increase, and this may be another factor in causing stroke. Stroke can present in various ways. It can present either a person suddenly becomes unconscious and after some time he regains his consciousness, he becomes giddy, he falls down and then again he regains his consciousness. This is called as transient ischemic attack, where the patient recovers his consciousness within 24 hours of becoming unconscious. That is one thing. And second thing is a major stroke, where the patient has limb weakness when he gets up in the morning. A stroke can be either a embolic stroke or a thrombotic stroke. Embolic stroke is one where embolus get dislodged from somewhere else in the body, for example in the heart, where embolus can form in people with valvular disease, from there it can come, or in some other parts of the body where embolus can get dislodged from some other place and can lead to a stroke. Second thing is thrombotic stroke, where a thrombus by itself will form in the blood vessel, in a particular blood vessel in the brain, and it can lead to weakness. Stroke presents in various ways, and based on which portion of the brain gets damaged, stroke can occur. For example, if a person is speechless and if a person is unable to understand your words, then you can suspect a left side portion of the brain being damaged. When a person is unable to speak and when a person is unable to understand your words or language, then you can come to a conclusion that the left side of the brain is damaged. These are the simple things which should better you know about stroke. The earlier you go to the hospital in a stroke, the better will be the improvement in the person. So for example, if you take a transient ischemic attack, it is better you go to the hospital and get yourself investigated with a CT brain, with CT angiography, so that all vessels are normal, and that is a very simple investigation which can be done fast. The second thing is a major stroke. If it happens, you must have to go to hospital for sure and get investigated. Nowadays there are the earlier you reach the hospital, various modes of management are there. One is medical management, the other is interventional management, and third thing is surgical management. Based on the golden period or the time when you reach the hospital, people will do what is essential for you. So these things, it's better the public becomes aware, so that if you can save yourself as well as you can provide this information to some other people. Anyway, giving a small information about stroke, I request you all to stop smoking if at all you are a smoker, and moreover to the younger generation, especially to the younger generation, I request you all people, please do not smoke, control your blood pressure, so that you don't get either a thrombotic stroke, an embolic stroke, or a hemorrhagic stroke. Hemorrhagic stroke is where there is a bleed in the brain, which is more dangerous, and if it is a small bleed, it subsides. If it is a deep bleed, then it requires surgical intervention. So taking all this into consideration, at the end of the year, I wish you all a happy new year and a happy and a prosperous new year and a safe and healthy new year and long life. Thank you.